Barbie mania has swept the nation. So on this video, I'm going to react to human Barbie dolls. What did they get done to look like a human Barbie?
Tara Jane McConaughey has spent over $200,000 to become a real-life Barbie. The social media star has had 5 breast augmentation surgeries.
She doesn't look like the Barbie dolls that my friends played with when they were kids. She looks more like a carnival funhouse version of one.
6 rhinoplasty surgeries, bum implants, and endless jabs of Botox eyebrow lift injections and lip filler.
So this is a situation where, you know what, if she's happy with her results, then good for her. But as a plastic surgeon, this is not something that I would recommend or do. The first thing is, how do you get your lips so big, and what are the dangers of doing that? Well, there are 3 technical ways to enhance the lips. The first thing is you can use your own fat. You can take fat from your tummy or your thighs, purify it, and have it injected into your lips. Well, as you can see in that video, she has no fat to harvest, so that's not why her lips are so big. Second thing is you can use an implant. There are silicone implants and implants even made of cadaver skin. Yes, you can get cadaver skin placed inside your lips to make them bigger. And the third way is the most common way. It's injectable filler. Now, this is not something where you can take lips that are, say, my size and then make them her size in one treatment. This is something that you have to inject somebody, typically many treatments over the span of months, if not years, to make them that big. And the risk is that the more filler you have injected, the more risk of scar tissue, and there's even a risk that her lips can be so full of filler that they can tear open and that filler can ooze out. Not fun.
Because so many of her procedures only have temporary effects, she has to spend thousands of dollars on ongoing maintenance. Tara replaces her Botox injections up to 30 times a year.
She gets Botox 30 times a year? That has got to be a mistake, because Botox typically lasts about 3 to 4 months. And so most of my patients undergo Botox injections 2 or 3 times a year, not 30. If it was 30 times a year, literally some weeks she would have to do it twice, and that is just absolutely bonkers. There's no way that that's true.
And spends around $2,000 for the lip filler injections and up to $3,000 for the Botox brow lift injection.
While Botox lasts about 3 to 4 months, injectable filler can last anywhere from 6 months up to 2 years if you use a hyaluronic acid filler. So for her to spend $2,000 a year, you're probably looking at about 2 to 3 syringes of filler. That's 2 to 3 cc's. That's actually not a huge amount. With her lips, my guess is that she's just had filler done for so many years, it's just compounded on each other. I do believe that if you undergo a lot of injections of filler, literally month after month, year after year, that you can deposit scar tissue, and that in and of itself can add volume.
Once travel restrictions are lifted, she plans to have her eyes recolored and have some of her ribs removed so that she can have a more tapered waistline.
I think her waistline is already really tapered, don't you? So there are reasonable procedures in plastic surgery, and there are procedures that are just way out there. There are doctors who are removing ribs to make somebody look more quote-unquote snatched. And the idea is that you can remove those ribs that are on the lower portion of the ribs. I don't know, the ones that are protecting your liver and your spleen. You can remove those and it can make your torso look thinner. This is not something that I recommend. I have removed portions of a rib before when we need that rib cartilage to do basically grafts for reconstructive surgery, but I've never seen somebody cosmetically have them done, although I know it's being done by certain doctors across the country. Now, there are a ton of risks of removing your ribs for cosmetic reasons. The first thing is you can puncture a lung. You can get a deflation of your lung that would necessitate a chest tube, and that is just not fun at all. Second thing, as I mentioned earlier, is your ribs are there as a basically cage to protect your inner chest organs. If you remove portions of that cage, what's going to happen if you get trauma to those areas? Not a good thing.
She also wants to get larger breast implants. Her current size is 1,050 cc, and she wants to upgrade to 1,500 cc's.
Here in the United States, we make implants from like around 100 cc's up to 800 cc's. Now, you can go bigger by taking an 800 cc empty saline implant and overfilling it to 1,000 cc's or so. But how do you get to 1,500 cc's? Well, you can take that implant and you can overfill it to 1500 cc's. Now implants, that outer silicone rubber is really, really strong. But if you expand it to that size, obviously you're going to have the potential risk of that implant popping. The second way to go up to that size is to go to another country and see if they can custom make you your own implant of that size. That does not happen to my knowledge here in the United States. And the third way is that you can stack your implants. You can literally have more than one implant in each breast. Yes, you can have, for let's say 1500 cc's, a 800 and a 700 cc implant on each side. Just not a good idea.
Angelababy is one of Asia's most famous stars. She has battled plastic surgery rumors for years now, but insists she's never had any work done to her face.
Okay, now we're actually looking at somebody who looks like she hasn't had overdone plastic surgery. Now, South Koreans per capita do more plastic surgery than probably anybody in the entire world. And my opinion of just looking at her briefly is that she appears to have had a good amount of work done, but work that has been done very conservatively and very well.
Yes, there could be some truth to that, but her plastic surgery before and after pics say otherwise. You can definitely tell that her nose, jawline, and chin all look drastically different than before. She doesn't even look like the same person anymore.
Okay, so let's take a look at her before and after, the first one that they showed on screen, and I'll let you know what I think she's had done. So to me, it's pretty apparent that she's had a rhinoplasty because her nose looks thinner than it did before. And her nostrils as well appear to have been narrowed, her tip refined. If you look at her upper eyelids, most likely she had an upper blepharoplasty. She also had probably a very small epicantoplasty, and this is an operation where you basically remove skin from the inner portion of your eyelid to help open that up. She appears to have had a chin implant placed because her chin definitely looks like it's a different shape than it was before. And most likely she had some jawline contouring, possibly with Botox, or sometimes they'll actually shave some of the muscle down on the sides of the jawline. She may have also had an upper lip lift and possibly a buccal fat removal, which is fat removed from the inside the cheeks, also help contour the cheeks in. And then finally, maybe a touch of filler in her upper cheeks as well. If you look at the color of her skin, this could just be coloring from the photos, but she also could be undergoing some skin bleaching treatments. IV glutathione is a very common way that people do that in Asia, and it's starting to happen a bit here in the States as well. Are you looking for radiant, glowing skin? Look no further than the Youn Beauty 2 Minutes 5 Years Younger Skincare System. Whether you're looking to reduce the appearance of fine lines and wrinkles, brighten your complexion, or simply maintain healthy, youthful-looking skin, my Youn Beauty products are here to help. Do you believe you can look upwards of 5 years younger in just 2 minutes a day? It's true. Check out our online store at younbeauty.com or download the Youn Beauty app on your phone to order yours today.
Anastasia Shapagina is yet another girl from Ukraine that claims not to have had any plastic surgery to achieve her Barbie doll appearance, and says it's the result of 1 hour's worth of makeup application. But that nose, though.
Okay, now we're actually looking at people who do truly look like real Barbie dolls. For her to say she's not had plastic surgery, let's watch a little further and we'll analyze her photos.
Oddly enough, she and Valerie Lukanova are also good friends.
Okay, imagine you're walking in a park and you walk by the two of them sitting on a park bench. I think like you could not help but just stare because they really do look like real life Barbie dolls. I mean, it is absolutely shocking and almost like kind of uncanny. I mean, why they didn't include them in the Barbie movie is beyond me.
This is Anastasia's tagline on her VK page. I'm not like a doll is like me. Well, okay, Anastasia. Judging by your plastic surgery before and after pics, you look like a girl that had plastic surgery and then applied heavy makeup in order to look like a doll.
The commentator is kind of mean, I think. She's been kind of mean throughout this whole video so far. So let's take a look at her photos and we'll break down what plastic surgery I think she may have had done. So first, let's take a look at her eyes. And obviously she's got a ton of makeup around her eyes. I think it is really impressive how some of these people can make their eyes look so huge just by makeup. It's definitely possible she's had some surgery to it. Obviously you can see that the under eye hollows are gone. That could be due to injectable filler. Some of that I think is probably due to makeup as well, but those are that's a pretty big change just from makeup. Obviously the number one thing is her nose. And as much as contouring can be so powerful, I can't imagine that her nose has not been thinned out by at least one rhinoplasty, if not more. The thing though is when your nose is this narrow and this small, I can't imagine that she can breathe really well through it. And that's a huge thing that I would worry about in a patient like this, is can you breathe through a nose that has been that aggressively narrowed? She may have also had a little bit of filler put in her lips, but not a ton. And when you look at the shape of her face, it's possible she's had a little bit of filler put into her chin. She may have also had a buccal fat removal to help kind of narrow the face there, and some Botox into her masseter muscles to help narrow the face even more. Overall, I think this is a very impressive Barbie doll appearance. Let's see who the number one human Barbie doll really is.
Valeria Lukanova was born in Tiraspol, a miserable, gloomy city in Moldova. Just like the other girls on this list, Valerie refuses to acknowledge that she's had plastic surgery to achieve that Barbie doll look. She insists her appearance is strictly the result of diet, exercise, and makeup.
Man, that commentator is so mean. What does she have against Moldova? Now, I don't like her tone of voice and how she's being mean to this person. I do agree with her that I can't imagine that this is all non-surgical.
Really? Now, we don't believe that one bit.
So let's bring up that very brief shot of her torso. And I mean, her tummy is absolutely flat as a board. Is there a possibility that she's had some liposuction? Definitely possible. Has she maybe had some ribs removed? That's also possible as well. But let's go ahead and take a look at her face now, and let's break that down. I think firstly, the most impressive thing is how they do this makeup around their eyes to make them look so huge and doll and dough-like. It really is impressive. Like the last woman, I do think she has had a rhinoplasty, at least one, and once again, I think you combine that with some aggressive contouring makeup, and it's looking the way that it does. I do believe she has had injections of filler into her lips because her lips do look unnaturally plumped up. And if you look at the contour of her jawline, like the last person, I do think that her jawline has also been thinned, possibly due to injections of Botox into her masseter muscles, possibly due to some fillers into her chin itself to make it look a bit more pointy. And she may have also had a buccal fat removal to reduce some of the fullness of her cheek hollows. I also think it's possible that she had an upper lip lift with injection of filler into the philtral columns, and that's those two kind of areas that protrude in that upper lip area. Now overall, I would see why they would name her the number one human Barbie doll, because she really does look like a real life doll. But what about the human that actually played Barbie in the movie Barbie? Take a peek at my video right up here where I analyze Margot Robbie over the years. What plastic surgery do I think she has had done? I give you my answers. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.